Hello, and welcome to Physician Spotlight, which is a forum to learn more about outstanding senior leaders, young rising stars, and international colleagues in the field of nutrition to discuss important topics and ideas. And with the help of ASPEN, we are bringing these videos to you today. I'm your host, Dr. Lindsay Russell, and it's my honor to introduce our guest today, Dr. Keri Austin. Dr. Austin is an assistant professor of medicine within the Division of Gastroenterology and Hepatology at the University of Wisconsin School of Medicine and is an adult staff gastroenterologist with a focus on nutrition-related diseases and intestinal failure. Dr. Austin has conducted many quality improvement projects in endoscopy procedures and investigated methods for preventing endoscopy-related injuries among gastroenterology fellows. She is also a member of our Physician Engagement Committee within ASPEN. I'm so excited to have Dr. Austin here today. And Dr. Austin, thank you so much for joining us.
Thank you so much. It's great to be here. Thanks for inviting me. I'm excited.
I'm excited too. This is going to be really wonderful. And so the first question I have for you is, what was your journey towards a career that involved nutrition? If you could talk about that a little bit.
Yeah, so I think, kind of more common in the US medical education system. I kind of kept waiting for it to start. There's a lot of delay in nutrition education in our system. And so starting in medical school, I was kind of eager to learn a little bit about nutrition. And I think we had maybe one class. And so then residency, internal medicine residency, thought something would come there. GI fellowship, really nothing. And so one of the fellows that I trained with, her husband had actually done further nutrition education. Dr. Patel, who's very involved in ASPEN, and he recommended that I apply to a nutrition fellowship within Nestlé. And so I applied to that my last year of fellowship. So I did that program the first year as an attending. So back in 2018, started my nutrition journey then with some other great multidisciplinary physicians kind of from all over the country, internal medicine doctors and surgeons and endocrinologists, and really kind of the first exposure that I had to any sort of dedicated nutrition training.
So wonderful. And yeah, it's great to have, those access to those programs and different training. And, as a clinician, specifically as a gastroenterologist, how do you balance nutritional care in your GI practice?
Well, I think one of the nice things about GI and nutrition is that it kind of makes sense, and so I think nutrition, I'm a little biased, but I think nutrition is vastly important to every field within medicine. But I think in GI, we have a little bit of an advantage of patients making that connection themselves. And so oftentimes people, I think it's, on our website for find your doctor type of thing. And it'll say he has an interest in nutrition. And so I think I'm a little bit biased because most of my patients ask about some level of nutrition. But it's a very easy segue for me because one of the most common questions that we get as gastroenterologists, and I'm sure Lindsay, you see it too, is, what do I eat? And so I think as a new gastroenterologist, it was really hard because I felt such a lack of knowledge and knowing like, well, I can refer you to a dietitian, but I have no idea. And it left a little bit of dissatisfaction in myself as well as my patients, kind of making them come back and see which I still use our dietitians all the time and work really closely with them, but at least give a little bit of guidance to help start that relationship. More recently, I kind of started out with more of an intestinal failure focus, and I was one of the only person who sees patients. TPN was getting towards the end of his career, which I think is how a lot of younger physicians get kind of nudged in that direction. And so took over a lot of patient care for parental nutrition in the outpatient setting, but then also still saw a lot of inflammatory bowel disease patients. So that's kind of more of a turn in my career as of late, kind of dealing with nutrition-related concerns of inflammatory bowel disease patients.
Oh, that's so wonderful. And what you said really resonated with me is that, nutrition really affects every discipline in every area, and it is challenging when you have lack of training to be that support for patients in addition to our multidisciplinary team. So I think that's, it really highlights how nutrition really is the core of everything. I guess I'm biased too.
I know. Well, and
Yeah.
right now I'm actually doing a program through Cedars-Sinai and IBD diet therapies and a lot of it is looking at it's specific to IBD and nutrition, kind of starting at even with kind of setting you up for disease. Is there something in our diet? Why are the rates of inflammatory bowel disease increasing so much, especially in the Western diet, all the way to treatments and things like that. But really, it is a overall health, and it is kind of a cheat when you're talking to somebody who's got overall inflammation or rheumatoid arthritis and bringing that back to the diet. I think we're a little bit spoiled that we got some buy-in already just because it makes sense. And so it's kind of a nice push for the patient to be like, well, maybe this can really impact your disease.
Yeah, totally. And it's really interesting when you brought up is like using nutrition for therapy or preventative, like going back to the diet. Um,
Mhm.
Thinking about your journey in nutrition and how you mentioned you started kind of not late, but like in your early as an attending, kind of after your training. How has mentorship helped foster your career so far in nutrition?
I think mentorship is especially in nutrition because it isn't really taught, and kind of laid that foundation early in our careers. For better or worse, it's finding those mentors. And so for me, there were a couple people where I practiced. I'm at Wisconsin, and there were a couple people, but not a ton. And then you're kind of relying on one or two people. When I got involved with a more dedicated program, that is kind of opening it up to just so many more disciplines and people at different stages of their career, people who've been doing nutrition forever, and then those people that are in the program that are kind of more early on. And in a weird way, they serve as mentors too. Maybe even people, not in a weird way, but you know what I mean, in a different way, maybe more of like a support mentorship and peer support to help you in your career as well. And, doing papers with them and having more of a collaborative approach. With nutrition, I think it is really important to get more involved in societies because the field is a bit smaller. And so you can really reach out and make those connections across the country rather than if you just don't have that support locally.
Yeah, I totally agree. And I think, with our involvement with the ASPEN Physician Engagement Committee, I know there's like subcommittee on medical education that, working towards moving that needle along. And, the fostering the relationship with ASPEN with, the AGA or the ACG as well, really helps kind of guide you along. So that's very helpful, that answer that you mentioned that sometimes it might be small, but really seeking out the societies for support. Um,
Yeah, and I think it is making, steady progress.
mm,
The newer IBD guidelines are coming out and specifically recommend screening for malnutrition. And there is more of a focus than I think there had been prior.
yeah, and I also think that's a little bit patient driven as well. These patient
Mhm.
reported outcomes. I agree with you. Almost everyone I see in clinic is saying, what do I eat? What do I eat? And leaning towards more nutrition, sometimes over medical therapy or in addition to. So I think it's
Right.
very fitting that the field is going that way, especially in the profound inflammatory conditions like IBD.
Yeah, one of the things, so I give a couple lectures to the fellows, and one of kind of my goals is I'm the associate program director, and so a lot of contact with the fellows and just kind of getting that early nutrition training more in GI fellowship, just knowing that it's been lacking until then. Even going over the basics of micro and macronutrients, and but one of my favorite examples of how we're kind of failing our patients in this arena is if you go to the ccfa.org website, which is kind of a main patient information website for patients with inflammatory bowel disease. The very first picture that shows up is a patient and they say, and the caption is, "What do I eat?"
Mhm.
And so just kind of highlighting that that kind of the number one patient resource in the entire world of inflammatory bowel disease, the first thing is about diet. And so that kind of highlights to me where we're lacking as providers.
Yeah, no, completely agree. And I agree, the needle is moving and we're doing our best, but still lots to be done.
Slowly but surely,
Yes,
inch by
exactly.
inch.
And in that regard, with your experience of associate program director and for other audience members, any words of wisdom that you have for our early career healthcare providers or researchers in the field of nutrition that are listening in?
Yeah, so I think, I myself am a proud millennial. And one thing that we were taught very, extensively in medical school was boundary setting and when to say no, which is a great skill. But also, I think, knowing when to say yes, and getting involved, and especially if there's interest in nutrition, there's tons of opportunities out there, because it is a field that, you need exposure to how do you know you want to be XYZ type of physician if you have no exposure to it. And so rather than saying no, saying yes, and getting involved and joining the communities of people who have established careers in that, because that's really how you're going to find your way.
Yeah, I think that's so great. And I think, surrounding yourself with people who share the same compassion and recognizing that need that patients need for nutrition support and education, I think has been really helpful. And it's great to, meet colleagues like yourself and getting involved for research projects or, as you mentioned, opportunities to be on papers and kind of working together. I think that's really great. So I'm going to pivot for the last question. I always like to ask, outside of medicine, what is something that the audience wouldn't necessarily know about yourself that you would care to share?
Oh man. Okay. I have three children. I have three boys that I married my high school sweetheart and never left the city of Madison, Wisconsin. So I call myself a townie, and one thing that's really nice about that is building a community, and so having those people to help out, and you get the busy career of a physician, and so had three children, one in medical school, residency, and fellowship. And I would say that residency is the hardest time to have children.
Mhm.
That is my personal opinion about being a woman in medicine.
Well, you must be very busy with those three boys running around. I hope you're
Well, the other
finding
advice I feel like with doing so much of the fellowship training, and fellowship is a common time for people to have children as well. So I feel like I'm always around people having babies, and
it.
medical training, all of it can be a little bit traumatizing, but so can parenting. And so I've the young years of parenting. Now I'm better; they're older, but
Yeah.
it was a little bit of a rough go there.
But it's also good, support, not even career-based, but like, personal support as well and around the college.
Yes, and don't ask me what my children eat because it is complete junk.
I was gonna say, are you gonna prime them to be a gastroenterologist and nutrition?
They're all going to have IBD. All they eat is, processed foods and soda. So do what I say, not what I do, right?
Yes, exactly. Public service.
Nutrition is always a work in progress.
Yes, exactly. Well, that's wonderful. Well, Dr. Austin, I really want to take the time and thank you so much for joining us today. And thank you to ASPEN for their partnership to continue with this program. It was such a pleasure chatting with you today. And our audience, thank you so much for coming and taking the time to listening to us. And I hope everyone has a great day.
Thanks, Lindsay.